That pain in your big toe joint that's making it hard to walk, you probably don't need surgery to fix it. My name is Dr. Andrew Schneider, and I'm a podiatrist in Houston, Texas. After treating thousands of patients with big toe joint pain, I've discovered that most people can get a significant relief without ever going under the knife. Whether you're dealing with arthritis, turf toe, or hallux rigidus, there are proven non-surgical treatments that can get you back to your normal activities. In today's video, I'm going to show you exactly what's causing your big toe joint pain, the most effective conservative treatments available, and how to know when surgery might actually be necessary. You'll learn simple exercises that you can do at home, the best orthotics and shoes for your condition, and advanced therapies can provide lasting relief. Before we get started, please take a moment to hit the like button and subscribe to the channel with the notification bell. This helps others with big toe joint pain find this crucial information. I post new videos every week with important foot health content. Big toe joint pain is one of the most common complaints I see in my practice, yet it's also one of the most misunderstood. Many patients come to me convinced that they need surgery, when in reality, there's numerous effective non-surgical options that can provide excellent relief. The big toe joint, technically called the first metatarsophalangeal joint, is crucial for normal walking. Every time you take a step, this joint has to bend upward to allow you to push off the ground. When this joint becomes painful or stiff, it affects your entire gait and you lead to problems throughout your body. There are several different conditions that can cause big toe joint pain, and understanding which one you have is crucial for getting the right treatment. The most common causes include Hallux rigidus, which is arthritis of the big toe joint, turf toe, which is a sprain of the ligaments around the joint, and sesamoiditis, which involves inflammation of the small bones underneath the joint. Hallux rigidus literally means stiff big toe, and it's exactly what it sounds like. This condition develops when the cartilage in your big toe joint wears away, leading to bone-on-bone contact. The result is pain, stiffness, and often formation of bone spurs around the joint. Many people notice their big toe doesn't bend upwards as much as it used to, and they may develop a limp to avoid bending the joint. The progression of hallux rigidus typically follows a predictable pattern. It often starts with a mild stiffness and occasional pain, particularly after activity. Over time, the joint becomes increasingly stiff and painful, and bone spurs may develop on top of the joint, creating a visible bump. In severe cases, the joint might be completely rigid. Turf toe gets this name because it was first commonly seen in football players who played on artificial turf. It occurs when the big toe is forcefully bent upwards beyond its normal range of motion, causing injury to the ligaments and the joint capsule. This can happen during sports activities, but it can also result from stubbing your toe or other trauma. The symptoms of turf toe include pain at the base of the big toe, swelling, and difficulty pushing off when walking. Unlike hallux rigidus, which develops gradually over time, turf toe typically has a sudden onset following an injury. The good news is that turf toe often responds well to conservative treatment when addressed promptly. Sesamoiditis involves inflammation of the sesamoid bones, which are two small bones located underneath the big toe joint. These bones are embedded in tendons to help the big toe function properly. When they become inflamed, usually during repetitive stress or direct trauma, they can cause significant pain in the ball of the foot beneath the big toe. People with sesamoiditis often describe the pain as feeling like they're walking on a pebble. The pain is typically worse when pushing off on the big toe and may be accompanied by swelling and bruising in the area. Now, regardless of which condition is causing your big toe joint pain, there are several effective non-surgical treatments that can provide significant relief. The key is choosing the right combination of treatments for your specific situation. One of the most important aspects of treatment is modifying your activities and footwear. Shoes play a crucial role in big toe joint health. Shoes with a narrow toe box or high heels can compress the joint and worsen symptoms. Instead, look for shoes with a wide toe box that allow your toes to spread naturally, good arch support, and slight heel elevation. For people with hallux rigidus, shoes with a rocker sole can be particularly helpful. These shoes have a curved sole that helps you roll through your step without requiring as much bending of the joint. Many athletic shoe companies are now making walking shoes with this design. Custom orthotics can be extremely effective for big toe joint pain, especially when the problem is related to abnormal foot mechanics. Orthotics work by controlling the motion of your foot and redistributing pressure away from painful areas. For big toe joint problems, we often incorporate specific modifications like a Morton's extension, which limit motions at the joint, or a dancer's pad, which redistributes pressure away from the sesamoid bones. Physical therapy and specific exercises can help maintain joint mobility and strengthen the muscles around the big toe. Simple exercises like toe curls, marble pickups, and gentle range of motion exercises can help keep the joint moving and reduce stiffness. Stretching the calf muscles is also important, as tight calves can increase stress on the big toe joint. Anti-inflammatory treatments can provide significant relief for many people with big toe joint pain. This includes both oral medications like ibuprofen or naproxen and topical treatments like anti-inflammatory gels or the Toslin CBD/CBG transdermal cream that we offer in the office. Ice therapy after activity can also reduce inflammation and pain. For more persistent cases, injection therapy can be very effective. Corticosteroid injections can provide significant pain relief and reduce the inflammation in the joint. These injections are typically done in the office and can provide relief for several months. For some patients, multiple injections might be beneficial. Advanced regenerative treatments like platelet-rich plasma, or PRP, are showing promise for big toe joint conditions. PRP uses your body's own natural healing factors to stimulate tissue repair and reduce inflammation. While more research is needed, early results are encouraging for certain patients. Taping techniques can provide immediate relief with some people with big toe joint. Turf toe taping, which limits upward motion of the big toe, can be particularly effective for acute injuries or flare-up of chronic conditions. Your podiatrist can teach you proper taping techniques for you to use at home. For people with sesamoiditis, padding and offloading techniques can be effective. Special pads can be placed in your shoes to redistribute pressure away from the painful sesamoid bones. Dancer's pads, J-shaped pads, and custom molded accommodations can all be helpful. Weight management can also play a role in reducing big toe joint pain. Excessive weight increases the stress on all joints of your feet, including the big toe joint. Even a modest weight loss can significantly reduce joint stress and improve symptoms. Activity modification doesn't mean you have to give up all the activities you enjoy, but it may mean modifying how you do them. For runners, this might mean switching to softer surfaces or reducing mileage temporarily. For dancers, it might mean avoiding certain moves that stress the big toe joint. The timing of treatment is important. Early intervention often leads to better outcomes and can prevent progression of conditions like Hallux Rigidus. If you're experiencing persistent big toe joint pain, don't wait for it to become severe before seeking treatment. Many people worry that non-surgical treatments are just temporary fixes, but this isn't necessarily true. With the right combination of treatment and lifestyle modifications, many people achieve long-term relief without ever needing surgery. Even when surgery is eventually needed, non-surgical treatments can often delay that for years. It's also important to understand that surgery for big toe joint problems, while often successful, comes with its own risks and limitations. Recovery can take several months, and some procedures result in permanent stiffness of the joint. This is why exploring all non-surgical options first makes sense for most people. The key to successful non-surgical treatment is to find the right combination of therapies for your specific situation. What works for one person may not work for another, so it's important to work with your podiatrist, who can evaluate your individual case and develop a comprehensive treatment plan. Regular follow-up is important to monitor your progress and adjust treatments as necessary. Some treatments may take several weeks or months to show their full effect, so patience is important. Your podiatrist can help you understand what to expect and when to consider other options if your current treatment isn't providing adequate relief. If you're dealing with big toe joint pain, don't assume surgery is your only option. There are many effective non-surgical treatments available that can provide significant relief and help you return to normal activity. The key is getting an accurate diagnosis and working with a qualified podiatrist to develop a comprehensive treatment plan. If you found this information helpful, please share this video on social media. Your simple share can help someone find relief from chronic big toe joint pain. Also, leave a comment below if you have a question about big toe joint conditions or treatments. I do my best to respond to everybody. If you're ready to explore the non-surgical options for your big toe joint pain, schedule an appointment for a comprehensive evaluation. We can determine the exact cause of your pain and develop the personalized treatment plan to get you back to your normal activities. The link to schedule is in the description below. Thanks so much for watching, and have a great day.